Welcome to the Healthcare Revolution podcast, where we empower you to take control of your health, restore your trust in the medical system, and achieve lasting wellness. I am your host, Brad Powell. I'm a doctor of physical therapy and owner of an award-winning foundation physical therapy here in the Salt Lake Valley. Each episode, we dive into all things rehab prevention, overall health, bringing you expert insight from leaders across various healthcare fields. Please note, while we aim to provide you with the best knowledge and advice, the opinions shared represent those as experts and are not to be replaced by professional medical advice. So let's revolutionize healthcare and wellness together. Today, I have with me a good friend, Shane Waller. He has a vast experience in being a patient, and he's going to tell his patient experience. He had a really unique perspective where I believe he was almost paralyzed from back pain.
Yep.
And tell me about that story. What happened?
Yeah. Well, let me rewind to the age of like 12.
Yeah. And I will say, if you have back pain, this is the podcast for you. We're going to talk about one of the most extreme cases that I've seen. And I appreciate Shane telling his story. But yeah, jump into that story.
Yeah. So I'm pretty passionate about this. I get all riled up when I have friends getting back surgery or planning on getting back surgery. So my mom, all growing up, she had back surgery after back surgery after back surgery. So in my mind, I don't know if you even know this, actually, ever talked about this, but in my mind, it was just always like we had bad backs in our family.
Mm-hmm. Yeah, genetics play a small role in back pain, for sure.
Okay.
But it's very small. Well, most of the time, it's a mindset, and it's how you train or how you the lack of training, you know. But you can bulletproof your back. You know, there's so many things that we can do. You know, it's one thing if you have, you know, severe scoliosis, right? That's completely genetic. That's nothing we can control, right? But most people that think that they have a bad back, 80% of people in the United States have back pain at one time. It's literally a pandemic. You know, we spend more healthcare dollars on back pain than most healthcare conditions out there, almost up to cardiovascular disease. It's wild how much we spend on back pain, you know? So let's hear the story.
Yeah. So in my mind, I've got a bad back in my family.
Yeah.
Right. And so growing up, I'd have
very fragile. You can break
pain.
it easy.
Yeah. I'm going to get hurt. I'd go to the chiropractor. Then had, I don't know, probably 4 or 5 episodes leading up to like the main episode event, but my back would just get tight. I'd give it a rest for a few days, slowly kind of go back into the gym. I remember one time I had like a steroid pack. It was like a 8-day pack, something.
Yeah. How many years ago was this?
That was at the age of 23 for me, probably.
And how old are you now?
I'm 34 now.
Okay, so a few years ago.
Yeah, so 11
You're getting on up there, man.
11 years ago. I think you are too.
Yeah, we're the same age.
Okay, so I thought I broke my back. I had it x-rayed. They gave me a steroid pack, told me it was just swollen, whatever. So
you go to the emergency room or the primary care?
Like primary care.
Okay.
Yeah.
So they're just kind of helping you manage it, kind of put a Band-Aid on it, get it feeling better.
Yeah, I think they didn't know what to tell me.
Yeah.
Honestly. So that was just take these steroid packs.
Yeah. And in full defense of a primary care doc, their role is not musculoskeletal. You know, I believe that most primary care docs get around 2 to 3 weeks of musculoskeletal training. You know, it's 3-year doctoral program for us. You know, that is our bread and butter. We know back pain better than anyone else, you know?
Yeah.
So really, we need to work really well with primary care providers and get those patients in to see us to reduce the recurrence of those low back pain cases.
Yeah, interesting. All I was told was steroid pack, go rest, heat and ice.
Yeah.
So I did that and it worked. Then a little while later, had another episode, did the same thing, another episode. Didn't have time to go to the doctor, so I didn't. It healed. I was like, okay, cool. Then the biggest one where you and I reconnected on this was woke up 4 a.m, my normal routine, go into the bathroom.
Yeah, Shane's an early guy. He wakes up real early to start working out.
Go into the bathroom. I take off my clothes, throw them on the floor, turn on the shower.
This is the best part.
I have to share this part because it is the best.
You got to visualize this for Shane here.
And so the visualization, I'm butt naked, about to hop in the shower. Love my wife, and I look over and see there's clothes on the floor. I'm like, oh, she'll kill me. Let me pick those up. That was the mistake. Reached down, picked them up, a t-shirt off the ground, and collapsed to the floor.
Oh my gosh. What'd you feel? What'd you think?
The first thought was I was going to have to let go of my assistant for my business, because I was like,
that's your first thought as you're climbing off the ground?
Yeah, I'm like, I didn't even climb off the ground.
You're still
like,
on the
I'm
ground.
going to be paralyzed. I'm not going to be able to work. What am I going to do with her?
And keep in mind, what's happening with your legs at this point?
I don't even know. I could move my legs, but not my hips. Like my waist wouldn't move.
Yeah.
And it was just like frozen up. Then I remember on my hands and knees, dripping sweat. Again, butt naked. Like I'm on my way to the shower, right? Dripping sweat.
All from doing laundry.
Moaning,
that's the last time you've done laundry. Right?
Crying. I haven't done laundry since. Yeah, I'm just like whimpering. And then it's about 5 a.m. at this time. And Ashley comes into the bathroom. She's like, what are you doing? Like, shower's been running for an hour.
Oh my goodness.
And she starts laughing at me.
Great wife.
Laughing
we love Ashley.
Hysterically. She's like, what are you doing? I'm like, I can't move. And she's like, get up.
It's not that hard.
I can't even move. So she helped me crawl. I was on tile in our bathroom. And I was just like, my knees were then hurting. So I was on the tile. She helped me crawl to the bedroom on the carpet. And then I couldn't
You're
even.
literally crawling across the floor. Can't even stand up.
Oh, I couldn't even like.
Because of pain or loss of function or?
Mostly fear, I think.
Okay.
Fear of like, if I move, I'm going to paralyze myself because I didn't know what was going on.
You're thinking maybe you broke your back from picking up laundry.
Yeah, it's heavy shirt.
Bad back. Makes sense.
So yeah, I didn't.
And keep in mind, this is a guy that, how much were you deadlifting at that time?
Oh, probably 250.
I mean, a shirt.
Yeah.
Is what threw it off. You know? It's crazy.
No, it was really interesting because I was scared, couldn't move, and I couldn't even like.
And keep in mind, this is not normal, right? The things that why you have a recurring low back pain like this is because you're constantly aggravating something, and that was just the straw that broke the camel's back.
Mm-hmm.
People shouldn't think as they bend over to pick up a t-shirt like, oh my gosh, I broke my back, right? I should be worried about that, So this is very abnormal. Would you agree?
Absolutely, it should not be normal. I will tell you though, I think in reflection on like the last 15 years, I know why I kept having issues. So we'll come back to that. But so I couldn't even like lay down. My triceps were burning, my shoulders were burning. So I was like on my hands and knees for an hour.
Yeah.
So I had to lean against my bed on my hands and knees and slowly kind of like slide down to where I could like lay on my side. Yeah. I'm still naked at this point. I'm like feeling super embarrassed.
She didn't even get you shorts yet.
She didn't even get me shorts yet. And then to speed it up a little bit, we had both my dad and my father-in-law came over to help me get off the ground and into the bed. I couldn't move. They had to pick me up.
And remind me, weren't you like hauled off on a gurney in an ambulance or something like that?
I went to the ER and I couldn't even get in. The ambulance came, but they were nice. They're like, hey, we can charge you $2,000 to drive you 5 miles, or we can just put you in your wife's car. So they did that. And then
what nice guys.
They met me there and picked me up out of the car again and put me in the hospital.
Oh, that's good people. Don't tell insurance.
They were cool.
Or don't tell the hospital that.
Yeah. And then the diagnosis was muscle spasm at that point. Mm-hmm. Right. So same thing. They're like, yeah, nothing's wrong. I don't even know. Muscle relaxer, I think.
And then just expected to just figure it out.
Well, they told me physical therapy. They said do physical therapy.
Good. They followed the right route.
Yeah. So
what'd you do from there?
I did physical therapy, but it was basically my view on that was like they gave me a few stretches and it was like it'll figure itself out.
So you did physical therapy right after that. Tell me about your experience.
I worked.
Sounds like little stretches,
movement. I don't really remember those 3 months
It's
of
really
my life.
impactful.
Yeah.
For sure.
I remember working from my bed, trying to work from my bed,
Yeah.
and pretty much not doing anything
When did we
else.
get in contact from that point? You were
so-
in PT. I know you end up getting to a surgeon.
I was in PT probably for 3 months,
Oh my gosh.
but I didn't go.
This is the first I remember from this. I thought we'd gotten contact earlier.
No. Well, I didn't go. Like they're like, we need you 3 times a week. So I went a couple times. Like, this is not doing
So
anything.
you felt like it was a waste of time.
Absolutely.
Yeah.
Yeah. So I just like didn't
That's
go. I
it.
go like
I
once
mean,
a
I've
week.
heard that experience so much. We have to step it up in the PT profession.
Yeah.
You know, people feel like it's a waste of time. We should be giving them extreme value. You know, talk to me about where you went after that.
So I was sitting at my office, well, in between this and the PT experience. I saw 2 surgeons, both of which, I got a shot. What's it called? A cortisone
Injection.
Yeah, I got an injection.
That helped. It
that
didn't
didn't
help.
help. That didn't help at all. It just
We see a
caused
lot of
issues.
success with those,
Okay.
but didn't help. Saw 2 surgeons.
Not for me. Both surgeons told me microdiscectomy. So I said, okay, cool, let's schedule it. Went on my way, on the phone with Brad Powell. Yeah,
Keep in
man.
mind, I saw his story on Facebook, and I was like, and I was a new grad at this time. I'm like, I'm a month out of school. I'm like, let me have a shot, Shane. Come on, bro. Let me try it out. I'm like, your surgery's already booked. What do you got to lose? I think that's what I said, right?
Sure.
Something along those lines.
What I remember is you say, absolutely do not go into surgery before you come see me.
I was really arrogant. I do believe in surgery, but at the right time.
So I was like, dude, I'm busy. I don't know if I can. Like, when can you come in? Tomorrow, 5 a.m. Like,
It was early.
it was early because we
Yeah,
had
I
no
remember.
other slots. Okay. But I was like, whatever. If Brad is this confident, I will go see him once. Right? I go in.
I remember, didn't you come in a wheelchair? What happened? I can't remember.
No, by then I was walking.
You were
but
just, like, super,
hard,
like, in
hard
ton of
limp.
pain.
Yeah. And I walked in, and first thing you said, you're like, "Oh man, we got you." The fact that you walked in here, like, we can heal you.
I was way confident.
And
You
so
ever
I
heard
think
the Dunning-Kruger effect?
I
So
haven't. I
on
don't know what that is.
the x-axis, or on the x-axis, you have competence, and on
yeah.
the y-axis you have confidence. And initially, when you start in your career, and it's going from very or not competent at all to expert. So initially, you have this huge spike, and then you get to the very top. It's called the amount of stupid, and something like that. The amount of point of stupid. I can't remember the exact term, but it's pretty much the amount of stupidity, like where you have the most amount of confidence but the least amount of competence. I think that's where I was at.
Yeah, definitely. It worked.
Well, I'm glad I had the
It
confidence.
worked. So I saw you 3 times that week or something. It was like every other day for a week. Then the next week we did, I think, 2
What was the
times a
difference?
week. I think looking back was honestly the confidence. You're like, dude, we got this. Let's work through it.
Yeah.
And I just felt like I could trust you. Whereas my experience right before that was really, I was going in and there's like, here, this is what we're going to have you do. And I was like, I don't even know like who my physical therapist
I don't
is.
even know their name.
I don't know their name. They're
One
like
of the
sending me
I tell
with-
my therapist all the time, if your patient cannot repeat your name a month, 2 months after they graduate, you didn't do PT right.
Yeah.
Like, you got to develop a deep connection. You know, I also teach our therapists, like, effort matters. You know, when I go in with a patient, it's all in. I'm like, dude, Shane, I don't care if I need to call you every night. You know, maybe I cross some boundaries there, but like, I want to do everything in my power to get you better. Like, PT does work. Let me show you, you know, like, let's get through these hoops together and help you develop hope, you know?
Yeah, absolutely. Yeah.
What happened after that? Walk me through. So give me some things that happened with surgeons that was helpful, maybe not helpful.
So I already had like my post-operation back brace and all that stuff.
Which
like,
was really exciting for you. I remember
Yeah.
that. You're like, oh, I got this turtle shell that I'm be wearing.
yeah. Well, the biggest, I think there's two triggers there was your confidence and also the surgeon that I was going to use. He told me, he's like, you should never do deadlifts after this.
Mm.
And then I was like,
Huge pet peeve of mine.
oh, okay.
It's telling people what they can and can't do, right? You should
Yeah.
never do this. You should never do wall ball throws. You should never deadlift. You should never clean, never throw anything overhead. Like, that's life, you know?
Yeah.
Like deadlift, like literally you pick up a laundry basket from the floor. That's a deadlift.
A shirt.
You know
not
what I
even a
mean? We have
basket.
to train people, even our 90-year-olds. Everyone deadlifts. What do you mean we shouldn't deadlift? You know? And this is not combating what he said. You know, obviously you're in a very vulnerable state, and who knows if that's the words that he actually used. Like, I want to be respectful of that surgeon, as we all deserve that respect. But sometimes those things come out as providers and they're not helpful.
Yeah.
You know?
Well, I would say to his credit, I was telling you about this before we hopped on on this conversation, is I have a client who had a microdiscectomy 2 years ago.
Yeah.
And then just recently messed up his back again and had to have it fused.
Yeah.
So to that surgeon's credit, saying you should never deadlift, like my client that I was talking to yesterday, probably a good recommendation to him.
Yeah.
Right?
And I would
'Cause
argue
he didn't fully heal.
the biggest thing with deadlifts is you have to look at the mechanics. And are you wanting to go PR, like personal records all the time? Are you wanting to lift super heavy? What is the goal? And do you have enough strength through your erector spinae muscles, through certain core muscles, to be able to produce the load necessary? A lot of times people get hurt deadlifting because they're not ready for the load repetition or the intensity of what they're doing. Maybe they have a hip mobility deficit. Maybe they have an ankle mobility deficit where they're rotating and it's loading through the low spine. So a lot of it's figuring out what deficits do you have that are limiting your ability to optimally perform a deadlift. We maximize those. Deadlifts is one of the best things for your back if you load it properly. You know, if you're loading those mechanics, it's literally bulletproofing it. And I'll take that to my grave. Everyone should be deadlifting.
Yeah, I love deadlifts. I really do. I feel like that's one of the things that strengthened my back to where it is today.
Yeah. Awesome.
But one of the things I remember that you taught me, a lot of it I think is so that because I haven't come back to see you since we had that big event for my back, at least. For other things,
That's
I keep
awesome.
messing myself up, but not for my back. It's been resolved.
Yeah. And I always tell athletes, like, if you're not getting hurt in the gym, create little injuries, you're not doing it right. You know, and that's not to be rude, or that's not to say like you need to come to therapy or any other healthcare. It's purely like, if you're pushing your body, you're challenging yourself, you're going to have little tweaks every now and then, you know. Then most of them you can take care of on your own, and we'll teach you kind of those components. But it's better than heart disease. It's better than, you know, having strokes, right? You're in the gym, you're working hard, you're pushing your body to its max. That's where it's at.
Yeah,
you know, if
absolutely.
you're not hurting yourself a little bit, you're probably not doing it right.
Yeah,
you
that's
know,
fair.
and that's not to say like people should be hurting themselves by all means, but like push your body. That's what we're supposed to do. That's how you get it stronger. You know,
Yeah, absolutely.
But what are your thoughts? So you're surgeon. You met with the surgeon, told you maybe you shouldn't deadlift anymore, gave you the back brace, scheduled for the discectomy. Tell me about your MRI. What did your MRI show?
Okay, so the MRI was really educational for me, I guess. Like the insight I got from that, I could kind of visualize and see, okay, this is what's causing the issue. And so one reason I think why I always had, like in air quotes, back problems, a bad back, is because when my back would get tight for any reason, I would bend over and stretch it. Like I would lean down, bend over, stretch it. And visually from that MRI, I'm seeing myself like put the opposite direction of pressure that we want on there, right? And so it causes more issues. And my back would be tight in the morning, so I'd bend over, let it crack, and like do that thing, right? That I think it would cause more issues.
Yeah.
So now, whenever my back gets tight I did deadlifts this morning, actually.
Nice.
Back gets a little tight. I know what I need to do now is apply that opposite pressure and just kind of work into it.
So when you look at the MRI, when you look at that image you showed me just a minute ago, what did it look like?
How to explain it? You've got your discs all lined up. And how I visualize it is...
This is definitely anatomy terms for sure. Go for it. You give it your best shot. I'll fill in the blanks.
Here we are. Financial advisor, fitness guy, trying to explain how the discs work on a back.
Yes, absolutely. I'll give it your best shot.
So you've got your discs all lined up, right? And your sciatic nerve is right there on the back.
That's the spinal cord.
Spinal cord.
Yeah.
Okay, your spinal cord. Basically, the disc is getting pushed out backward.
How big
toward my
was your
back.
bulge? How big did it look?
Oh, it was bigger than the space that my
It is
spinal cord
literally
was
the
allowed.
biggest one I've ever seen. It was like
Really?
collapsing the spinal cord,
Yeah, it
right?
was smashing
And
the
when
crap
we
out of it.
do tests, we call these hard neurological findings. So we'll test your reflexes. I remember when I test your reflexes, I was like, internal panic. I was like, don't let my face show, but I'm worried, right?
Yeah.
I remember testing. I'm like, I am very worried. You should be scheduled for that surgery based on what I'm testing. It was completely absent. So if you're in the medical industry, you know what an absent DTR is, deep tendon reflex on that side. Numbness, tingling, like everything showed MRI. You need that surgery, man.
Yeah. It was the
I
left.
never said that to you.
It was
but...
the left leg. Yep.
Oh, okay. Yeah.
Yep. I remember even like when I was driving to you, that whole left side was like so tight on the back,
Mhm.
and my shin, it was just like needles in my shin from that tension,
Yeah,
and
I
like that
remember
tendon going all the way down. And so the first few times I came to see you, I remember I'd like pull over to the side of the road, lean my seat back in my car to like let it relax a little bit, and then sit back up. And
Yeah.
And
keep in mind, I mean,
thing's
this was like one of the
smashed.
most severe cases I've seen in my career. This is way early on my career, but definitely one of the most severe I've seen. What do you, in your mind, what do you think happened to that disc? Like, what's your thought process?
You mean since I've gotten better?
Mm-hmm.
Oh man, I visualize it.
Yeah.
This is one of the reasons why we talked about getting an MRI post recovery and decided not to, because I visualized that it sucked itself back in.
Yeah, kind of reabsorbed in a state. Yeah, and there's, I can't tell you how many cases I get in my office that a surgeon or an NP or a PA tells the patient, like, yeah, those don't reabsorb. And I will say, like, I've seen them reabsorb. We've got post MRIs and they've reabsorbed. I'm not saying all of them do. A lot of them will, or there's some that will calcify and they won't reabsorb back into it. Yours was actually pushing halfway into the spinal cord.
Yeah.
It was wild to see how far it was pushing in. That's why you had all those leg symptoms. And that can become permanent. And that's why it's such a serious thing. But when healthcare providers give absolutes, like this won't reabsorb or there's no way it will. You just have to go to therapy just to check off the boxes. There's a reason why you have to go to therapy before.
Yeah.
The majority of cases get better. Even these severe cases, they all should go through a progression of therapy. The reason for therapy is to decrease pain, and we'll know really quick in therapy if it's not going to help. Our goal is not to put you in pain. It's to figure out if you can avoid that surgery. If we can keep your natural discs, your lifestyle is so much better, right? We want to maintain as much of your natural body as possible. The goal is not to go in and trim that off, right? And it can lead to a weakening of other things, right? We're going in, we're cutting into all these areas, and it's weakening a lot of those areas, But give me some advice for healthcare workers. You're a patient, right? What advice would you give surgeons, PTs, just healthcare in general to improve the patient experience? And obviously, you had a severe case, and we got through it, and you're deadlifting. You didn't need surgery, but just give me some general advice on what you learned from this experience.
Yeah. I don't know what goes on behind the scenes, right? So I don't know if this does or doesn't happen, but I feel like the communication between the surgeons and the physical therapist, or between whatever professionals, right, in different areas, I feel like they need to talk a little bit more and consult.
Yeah.
If
collaborate.
that's even an option.
One of the things that we do with a group not too far from here, Summit Brain and Spine, is we do rounds together where we present to each other on our viewpoint, our lens. What do we see? It allows us to see these things, these barriers that we can see from someone else's point of view. I love that. That's a great idea. So communication, improve communication across, and work together more so we can see each other's point of view. Love it.
Yeah. I think you can talk to this, but is there a concern with a surgeon referring to a physical therapist because they don't get that business? I go to the business side of it is where my mind goes. Like, do you think they have that concern, or?
I think I try to err on the side of, people are good.
Yeah.
And we're all in this profession to help. I think there definitely are people like that.
Yeah.
But I think the majority are good.
Yeah,
They really
that's
want
fair.
the best for each patient. What's interesting is we looked at some studies and rounds of the most expensive surgeries. So let's just say a spine fusion. You know what region of the U.S. has the most spine fusions?
I would have no idea.
It's Utah's a part of that region.
Really?
There's more spinal fusions in Utah and this western region than anywhere in the nation. And what we looked at is actually we get paid the least amount from insurance companies. The same insurance company on the East Coast, you know, in different various areas of the U.S., they pay significantly more and they have significantly less spinal fusions. There's a lot more conservative therapy. We have more fusions, spinal fusions, than anywhere in the United States here in Utah, in this western region. And a lot of it comes down to that's a higher paid service. So unconsciously, these surgeons might be going to a fusion because they got to make ends meet, you know? And there is a portion of that for sure. But I really think a lot of these surgeons are doing it unconsciously. You know, they want to help people. And, you know, patients come in and they're like, this is the answer, right? I want the quick fix. And sometimes that is a quick fix, you know?
Yeah.
But they don't realize they have to go to PT after anyways, you know?
They come to you afterward. Yeah, I can see that. There's some people really close to me that I know that they don't ever want to go to PT. They just want the quick fix me.
Yeah. What advice would you give physical therapists? You've been to a subpar one and maybe a little bit better one.
Yeah.
What advice would you give the PT?
Yeah, I'm just always a believer, no matter what the industry is people are going to care as much as you do oftentimes. And the fact that I could tell, you know, coming to you as compared to the PT that I went to right before, it was like I was just kind of in and out, didn't really know who I was talking to there. Coming into you, you're like ready to go, focused, I care. I was like, okay, this guy's serious.
Dude, I remember
cares
how
about
much I
this.
studied for your case.
Yeah.
I would go home for literally like 30 minutes home, 30 minutes back, listening to things, studying things at night. Like I was so obsessed with getting you better.
Yeah.
It was driving me crazy.
Well, we got there.
Yeah, it came through. I'm glad.
Right?
I love that. Like show you care.
Yeah.
You know, like that's really what it comes down to. I know there's so much we have to do, but you know, not every case is like yours. You know, we don't have to study at that level. But when we do, we got to get in, you know, we got to get our hands dirty and learn more, you know?
Yeah.
Any other last thoughts?
Yeah. I think the homework that you gave me was key. You can always give it to a patient, but they're not always going to do it every day.
Yeah.
Like, I just remember every single morning I was like going through all of the exercises you gave me every single day without
How
fail.
did you buy into that versus your other one was like, oh, this is a waste of time?
I think your belief in it, and also seeing like, okay, my option is either surgery, which my mom had multiple surgeries. And I remember as a kid, sometimes like she wasn't even able to do our laundry, right? As an example.
Yeah.
And I was like, I don't want to go down that route. If Brad believes this is going to work, I'm just going to do my part, be disciplined. And if it doesn't work, we did everything we could, right?
Yeah. I remember having that conversation with you. Like, dude, we got 6 weeks till that surgery. Let's go all in.
Yeah.
Do this every single day. Give it everything you got, and let's see where we get. You know, if it doesn't work, it doesn't work. But let's see if we can avoid that. You know, that's huge. Okay, man. Well, I appreciate you telling the story. Thank you for what you do for our community in general. I mean, you make a huge difference as a financial advisor. And thank you for telling your story and coming today and joining me.
Happy to. Thank you, Brad.
You're welcome.